these bills. And first up, we're going to bring forward Representative Leader Flowers with House Bill 53, which talks about transparency for prescription drug prices. Thank you, Leader Flowers.
Good morning, everyone. I'm State Representative Mary Flowers. I represent the 31st District. It's my pleasure to be here with my colleagues today to talk about this very life-saving situation. The reason why I've introduced this bill on transparency is because I do know in other countries the cost of this prescription drug is, or these prescription drugs are cheaper. And I also know that if I wanted to get the same type of heart medication for my dog, it would be cheaper for me to get that medication for my dog than it would for a human being. And so I need to understand the reason why. Why is it that it's cheaper to get the prescription drugs for heart medication or any other type of medication for my animal than it would be for a human being? And therefore, we need the transparency. We need to understand where is the cost coming from and the cost overrun, and why is it that when the doctor says that medication is medically necessary to save a person's life, and the insurance company cannot pay all of it, what is the patient supposed to do? Are they supposed to die because they can't afford it? I don't think so. Something has to be done, and done immediately. Thank you.
Thank you so much, Leader Flowers. Up next, we're going to bring forward Representative Theresa Ma, who's working on House Bill 3097, House Bill 3097, around academic detailing. Representative Ma.
Thank you. I'm Theresa Ma. I represent the 2nd District, which is on the near southwest side of Chicago. One part of the challenge of rising drug prices is making sure prescribers have good, unbiased information about new treatments. Right now, doctors hear about drugs through pharmaceutical company representatives, and we've all heard the stories about how doctors are wined and dined and encouraged to prescribe new treatments that are being pushed by these pharmaceutical companies. But the problem is that prescribers don't have a lot of good places to turn to for unbiased guidance about the efficacy of new medications. They can't only get their information from the people who are trying to sell these drugs. That's why we're proposing to create a partnership between DHS and the University of Illinois to form an academic detailing program. So House Bill 3097 directs the state to create this program and offer some guidance about how it should work. It's modeled after successful programs in other states like New York, South Carolina, and Pennsylvania. And in New York, for example, the program looked at respiratory syncytial virus, and it came up with a step-by-step protocol of when to prescribe treatment and distributed this to physicians. This ended up reducing the overall spending by 33%, or over $20 million, with no negative effects on outcome. So this bill will get good information to our providers to make sure people aren't being prescribed drugs that they don't need, which will help overall lower costs to the system and to our families. Thank you very much. And up next, we have Anna Moeller with HB 1441.
Thank you. Good morning. I'm State Representative Anna Moeller, and I represent the 43rd District, which is located in the northwest suburbs of Chicago in the Elgin area. As we've heard, we have a prescription drug crisis in our state. And as we are hearing today, we need to do more to ensure patient access to affordable drugs so they can live healthier, longer, and more meaningful lives. Most of the bills that we're talking about this morning are structural reforms to reshape the system of buying and selling drugs in Illinois. But people need help in accessing affordable medications right now. Already, many desperate families are traveling to Canada to fill prescriptions or are buying drugs online from Canadian pharmacies, because the cost of many commonly used pharmaceuticals are much cheaper in Canada than they are in the US, and as was referenced by Leader Flowers. And although 40% of all drugs and 80% of active ingredients used in our drugs are already imported into the United States, consumers purchasing drugs on their own from Canada often do so without being certain that they are buying from reputable sources or may face legal challenges in doing so. The good news is that the federal government allows for states to create wholesale importation programs from Canada. And that's why I'm sponsoring House Bill 1441 to bring safe, reliable, lower-cost drugs from Canada to Illinois. The bill would direct the Illinois Department of Public Health to create a plan for wholesale importation, ensuring safety, quality, and cost savings to consumers and the state. Then the Department of Public Health would submit this plan to the U.S. Department of Health and Human Services for approval pursuant to 21 U.S. Code 581, the federal law that governs this issue. This bill follows the model that Vermont passed last year, and several other states, such as Colorado, Utah, and Oklahoma, are currently considering. We need to ensure that patients in Illinois have access to safe, lower-cost drugs as soon as possible. I believe this is a critically important way to do so, and I look forward to engaging my colleagues on this bill in the coming weeks. And now I'll return this back to Representative Guzzardi.
Thank you, Representative Moeller, and thanks to all of the bill sponsors here with us today. Also, thanks to Representative Mayfield for joining us this morning. Leader Greg Harris was unable to be with us this morning, but he is working on another key component of these reforms, which is targeting the pharmaceutical benefit managers, or PBMs. It's an area that has become sort of risen to national prominence around the high cost of prescription drugs. I'd like to talk about two bills that I'm sponsoring in this area very quickly. The first is House Bill 2880. House Bill 2880 is an innovative new proposal to deter manufacturers from raising their prescription drug costs. It would basically create a fine for price gouging. So this is based on a formula that Medicaid already engages in with manufacturers. So manufacturers, when they raise their costs above inflation, they provide a rebate to the Medicaid program for that excess cost. So what we're proposing to do here in House Bill 2880 is to create a fine that creates the same sort of penalty for manufacturers here in the state of Illinois. So once again, if they raise their prices above the rate of inflation, they have to pay a fine based on that differential to the state. So that's revenue that's going to come into the state that we can use to drive people's drug costs down and provide affordable medication for everyone. And it also will act as a deterrent to manufacturers from making these big price spikes. If they're going to know they have to pay this penalty for price gouging, hopefully they will be less inclined to do so. And then briefly on House Bill 3493, which creates a prescription drug affordability board. The idea behind this board is that it would be a group of public entities and industry experts who would come together and set, if they saw prices increase again in a prescription by over a certain threshold, they would do an analysis of that drug price to see if the price increase was justified, request documents from the manufacturers and so on. And if they viewed the price increase to be unjustified, they would set what's called an upper payment limit for the payers in the state, so that the payers in the state would be capped at what they would be paying for the drug. They wouldn't pay the sort of arbitrarily high cost that the manufacturer had set. Instead, they would pay a capped cost. So that would drive savings to the state of Illinois in the Medicaid program and the retiree health programs and the other ways in which the state pays for people's prescriptions, and also, again, would drive manufacturers to bring their prices in check. And then briefly, before I turn it over to Claire McAndrew, who's here with us from Washington, I want to talk about the public opinion polling, which you all have before you here today. This was conducted as a poll of 635 likely voters in the state of Illinois, conducted last December. And I want to just go over some of the highlights here. I know it's a lot of charts and graphs, but we found a few things. We worked with a firm called Blue Sun Polling, and they conducted this survey, and we found a few sort of striking results. The first of which is that more than a quarter of Illinoisans didn't fill a prescription in the last year because it cost too much. I think that should be a staggering fact. 27% of people who took this survey said in the last year, my doctor told me I needed medicine to be healthy. And I went to the pharmacy and they told me how much it cost, and I said, you know what, I'm going to skip it. People are imperiling their very well-being and their very lives because they can't afford to pay for these drugs. And as you can see, it's not just a Chicago thing, it's not just a downstate thing, it's not just a thing for seniors or for young people. This affects all demographics and all geographies in the state. Illinoisans are urging us very strongly to take on this issue. You know, we asked people how this issue compared with other issues that the state government works on, and you know, it was almost identical to those sort of top priority issues we hear about all the time. So improving public schools or reducing crime, lowering the cost of prescription drugs was right there. 94% of people viewed that as important for state government to tackle, with 67% of people saying it's extremely important that we do this. So 2 out of 3 Illinoisans think it's extremely important for us to take action. And again, by contrast, 52% of people in the state think it's extremely important for us to lower taxes. So well more think that we need to do something about this than think that we need to do something about lowering taxes, which is a mantra we hear here all the time. We talked to respondents about a number of these interventions that we've heard today. The transparency idea, requiring companies to justify their price increases that Leader Flowers is working on. 85% of Illinoisans favor this idea. 69% of them strongly favor it. So this is an extremely popular idea. Importing lower cost drugs from Canada, 74% of people favor that idea. 52% of them strongly favor it. And then this fine for price gouging that we discussed here. Again, this is sort of a new idea, and we had to expose people to it for the first time, and yet still, overwhelming majorities of people, 59% of people think that this is a good idea. Only 22% of people were opposed to it. Obviously, there's a higher number of uncertain folks in that area because it's a new proposal. But as you can see, the general public is very much with us. And then finally, the voting public is saying that this issue is going to motivate their behavior at the polls. So they tell us that they are vastly more likely to vote for candidates who support crackdowns on prescription drug prices. And in particular, I think the number that I found the most compelling in this area was around undecided voters. So we said to people, which party would you likely vote for in the next legislative elections? Democrats, Republicans, undecided. And then we asked those people, well, if you knew that the candidate was cracking down on high prescription drug costs, would you be more or less likely to vote for that person? And among undecided voters, you see 74% of undecided voters said they would be more likely to vote for a candidate who took this issue on. Only 6% said they would be less likely. So the people who are trying to make up their minds about who ought to be in the General Assembly and what we ought to be doing, they're looking at this issue as of key importance. It affects them on a day-to-day level. They believe we need to take action, and they're willing to vote us out of office if we don't. So I believe that information should be very compelling to us as legislators and to the general public as far as approaching this issue goes going forward. So to wrap us up here, I'm going to turn it over to Claire McAndrew, who's the Director of Campaigns and Partnerships at Families USA, here to bring some national perspective to the discussion.
Thank you, Representative Guzzardi, and to all the esteemed Illinois legislators who are up here today. My name is Claire McAndrew. I'm the Director of Campaigns and Partnerships at Families USA. We are a national nonpartisan organization, and our mission is to ensure that the best health and healthcare are available to everyone, equally accessible and equally affordable. And we are so proud to stand here today as the Illinois legislators here discuss an important package of bills to address the critical consumer issue of high and rising drug prices. For far too long, consumers who depend on critical life-saving drugs have been at the mercy of pharmaceutical companies who introduce these drugs at outrageous launch prices and then raise those drugs to unaffordable costs with no justifiable explanation. Drug prices increase much, much faster than inflation, and even with good jobs and good insurance, family budgets can't keep up. And that's what the polling that Representative Guzzardi discussed shows today, and it shows how Illinoisans are affected all across the state. So states have a really, really important role in intervening in this problem. And so with today's legislative announcement, all the bills that are discussed, there are really leading solutions that are possible here in Illinois to address this, to address these abuses for Illinoisans. For example, Representative Guzzardi's proposal, the Prescription Drug Price Increase Act to restrict prescription drug price gouging, is a first of its kind bill that will hold drug companies accountable for these outrageous price gouging practices. And it's really important also that the solutions you heard about, they address the price increases through all parts of the supply chain, from the manufacturer to the pharmacy benefit manager to even the practices that occur at the prescriber's office. And although federal policymakers are engaging in important debates, it is really important that states move ahead because consumers cannot wait. And as we heard today, other states aren't waiting. So Illinois can't wait either because Illinois residents need solutions now. And so Families USA really urges the General Assembly to act. And Families USA stands ready to work with Illinois in support and to offer our help. And so we really just want to thank the legislators standing here behind me for being so proactive and responding to the concerns of consumers. And we stand ready to support you in any way we can. Thank you very much.
Thank you, Claire. That's it for our remarks for today. We'll take any questions if you got them.
So doctors get most of their information from drug reps. It could be said lawmakers get a lot of information from lobbyists. What's that part of the equation? It pertains to some of your bills and Big Pharma.
Well, I think that we, at every level of government, we've seen that the influence of the pharmaceutical industry has stood in the way of meaningful reform in this issue for decades. And I think what you're seeing in this particular moment is that the public outrage around this issue is so profound now that legislators at every level of government are feeling real pressure to act. And we saw that yesterday in Washington with the senators bringing the pharmaceutical CEOs in front of their hearings and raking them over the coals a little bit, justifiably so. And so I think you're seeing this moment where the tide is turning, where suddenly the popular demand for action is going to be hopefully a more powerful voice than the industry demand for inaction.
I thought making all the money you could was the American way. Whether you're selling widgets, selling pills, whatever.
Well,
I've got a U-Haul behind my hearse, by the way.
oh, that's good. I think what we've seen throughout the course of American history is that at moments when industry has taken advantage of consumers and they've gone too far, when they've consolidated too much monopoly power and manipulated markets to take advantage of people who need their services, government has stepped in to protect consumers over and over again in our nation's history. And that's the moment we're seeing here with pharmaceuticals. We're seeing that industry has a captive market of sick people who need their products. And they have these federal protections and other legal mechanisms to protect their monopoly power in these areas. And as a result, they can charge whatever they want because they know that sick people are going to pay. And it's time for government to intervene to stop these abuses and protect families.
So your legislation on imposing a tax against price gouging, that's a first of its kind legislation?
Yeah, go ahead. Sorry, I didn't know if that was your question.
Okay, if it's first of its kind, it's not been tested anywhere else. I feel like, could it invite lawsuits? Is there any sort of federalism issue?
That's a great question. So this legislation was conceived of by the Pew Charitable Trust, who does research in this area and has provided a lot of really good analysis in this. And they brought about this bill, in fact, as a response to litigation around legislation that I had last year, this bill that was passed in Maryland about price gouging. And that bill was struck down in the federal courts, and the Supreme Court recently said they're not going to hear it. So that bill's dead for the moment. But the initiative you have before you today around the fine for price gouging is a response to precisely the legal challenges of the previous measure. So they said, okay, if the courts are saying we can't do this, what can we do? And based on the previous Supreme Court decisions in this area, they crafted this fine proposal so as to make sure that it's constitutional and also try to tackle the same kinds of problems.
And in that particular bill, just piggybacking off of that,
Mhm.
you were talking about price gouging and what constitutes as price gouging? Anything that goes above the inflation?
So yeah, the bill as it's structured now is modeled off as Medicaid reimbursement. So when the way it works in Medicaid is that when drug prices go above the inflation, I believe it's the medical inflation rate. So it's a specific CPI that pertains to medical goods. Might need to fact check myself on that one, but I'll circle back to you about that. But when the price of a drug goes above that rate, they just provide a rebate for the differential to the Medicaid program. So they're already acknowledging, look, this drug went up too much, so we're going to give you some money back. And so that's precisely the margin that we're hoping to address with this legislation.
Representative Ma, can you, I guess I'm not quite grasping your bill. Does it have to do with experimental drugs that universities are coming up with, or, I'm sorry.
I think that it, so, with the example that I gave, I think that might provide some insight that, there are certain treatments that would result in step-by-step protocols that are, proven, evidence-based, and the information that would be distributed out to the providers would be based on studies and research rather than the goal to sell the medication, to push it through marketing.
But so these are things that are, they're not quite at the stage where they're like FDA approved?
No, they are.
Okay.
Sorry, let me-
Sorry, forgive me for
No, it's okay.
very
In-
limited knowledge of this stuff.
Just in as simple terms as I can muster it. So right now, pharmaceutical companies do what's called detailing. So they send out sales reps to doctors to give them details about new treatments, to say, hey, look, we came up with this drug. It's really great. Let me buy you lunch and tell you about how great it is. And there's a lot of good research to suggest that that leads to prescribers over-prescribing those medications. So this is called academic detailing because it's a public sector academic program that would explain to providers the real facts about how treatments ought to work. Unbiased factual information, not from a sales representative, but from an academic institution.
sorry.
Does that make sense?
Instead of just the drug companies providing all the information about the drugs, you can have evidence-based university faculty provide it.
Do doctors not have access to like medical journals and scientific research where they report?
They
on
do,
clinical
but there's
trials?
best practices for how the information can be provided in a clear, easy-to-use format for the purpose of providing that information to doctors. And so the states that Representative Ma spoke about have done these types of pilot programs for how to provide sort of the same type of formatted information through the same processes that a drug company might use. It's sort of like, that educational information for doctors, but instead of just the drug company way, you actually provide that programming for doctors' offices about new drugs through an academically focused program.
So it just sounds a little condescending to say that the only information they have is coming from drug companies.
Well, drug
These
companies
people don't
have the
medical
resources and the time. Like, they literally show up at a doctor's office with a briefcase to have a meeting with a doctor, regularly about because think about how many new drugs come to market. So every time a new drug comes to market, there are many people whose job it is to show up at the doctor's door and say, hello, a new drug has come. Here are all my brochures, and I'm going to talk you through it. And so this is to deploy more of academic professionals to walk people through those new drugs. And doctors, of course, do have access to academic journals, but if you know a doctor's patient load, most of them are struggling just to get through the day to see those patients. And the best doctors do spend their evenings reading academic journals, but that is a heavy load that I think we can all empathize to keep up with both of those things.
One more question.
Representative Miller, your bill, are any other states doing this?
Yes, Vermont passed a bill that would authorize their state to create an importation program. And there are several other states that are currently considering a similar measure.
Okay, and what kind of infrastructure do you imagine this would need for Illinois to become a licensed wholesaler? Like, would we literally have to set up, would Illinois be a pipeline that like you get stuff into a Walgreens, or would, government buildings serve as kind of a pharmacy? Like, what do you imagine?
Well, this bill would direct the Department of Public Health to create a plan for importation for the provision of the wholesale program. The plan would have to be approved by the federal Department of Health and Human Services before it could be implemented. And they would also be required to report back to the General Assembly on what the plan consists of. But considering that we have Vermont as a model, we have partners, nationally who are working on this issue, there are resources available to states and agencies in crafting this plan. It would be voluntary. This would merely ensure that the state is overseeing the importation of these drugs, and that the pharmaceuticals that are coming in are safe, that they're lower cost than those that are available right now, and that they're available to consumers. Because right now, as we're seeing, a lot of individual families and individuals are purchasing pharmaceuticals online from Canada and finding much cheaper, comparable drugs that are available from Canada. But they're doing it on their own, and this would create a safety mechanism to ensure that these drugs are safe and what they're purported to be.
But would the state take on liability then?
No, this would still be. It's like any other program where the state, operates a purchasing type program. There would be oversight that would be required by the Department of Public Health, but I don't envision that this would create any increased liability on the part of the state.
Great. Thank you, everyone, and we're available for follow-ups following on here. But I appreciate everybody's time. And last one. So I don't believe he's introduced a bill just yet. He's still working with the various stakeholders to put the final touches on legislation. Yeah. Great. Thanks, everyone.